Hi, I'm Dr. Lana Ruvolo-Grasser, aka Dr. Ruby. Today, I want to talk to you about really important changes in our federal government and how they have impacted not only scientists working on life-saving biomedical research, but also all of us who are impacted every day by scientific breakthroughs that save lives. Recent executive orders have changed the way that grants are being reviewed and funded in the United States. Federal grant funding for science is essential for research. The majority of research studies here in the United States are supported by federal grants that allow us to conduct research that helps us better understand the mechanisms underlying diseases, underlying health problems, contributing to the development of things like depression, anxiety, cancer, diabetes, and also helps us discover new treatments. Federal grant dollars, in addition, can support refining those treatments and ensuring that they work well for everyone, and that there is an option available for everyone. This includes not only medications and medical devices, but also behavioral interventions and therapeutic strategies that might be administered by clinicians, or even methods like smartphone apps, games, and other coping strategies. A recent executive order entitled Radical and Wasteful Government DEI Programs and Preferencing and Initial Recessions of Harmful Executive Orders and Actions is the primary driver of recent changes that have been made to how science gets reviewed and funded. This executive order is an attack on programs and initiatives that foster diversity, equity, inclusion, and accessibility, otherwise known as DEIA. I've been the beneficiary of DEIA programs, and I've also worked to promote DEIA initiatives in my workplace and in professional organizations that I am a part of. This work is important, ensuring that all individuals can contribute their knowledge to our fields of science and be benefited by that knowledge. DEIA programs help make life better for all of us, and they ensure that those who may have been, for example, excluded from research in the past or harmed by science in the past, that those harms are rectified and that efforts are made to include them and to ensure our science is representative of everyone. These attacks on DEIA are very harmful for all of us. And it is within this executive order that many changes to science, funding, and implementation at the federal level have been made. For example, this executive order forced the Centers for Disease Control, or CDC, to remove publicly available data from its website. These data were generated by taxpayer dollars. Our money contributed to this data. That means it belongs to all of us, and it should be publicly available. But because of these executive orders, critical information on things like HIV prevention and treatment, women's health, LGBTQIA+ health initiatives, all of this data has been eliminated from the CDC's website. Fortunately, many scientists have done important work in archiving data in saving this critical information. However, we cannot support initiatives that take away public data our taxpayer dollars have funded and are essential for public health initiatives that keep all of us safe and healthy in the United States. Another consequence of these executive orders has been a list of banned words that has been generated and shared with officials at the National Science Foundation. Individuals at the National Science Foundation have been instructed to exclude grant submissions from review and to not fund grants that include words like female, females, women, LGBT, accessibility, disability, racism, systemic, and bias. Even the word trauma is included on this banned words list. We here at the Ruby Resilience Lab are a lab that studies the impact of negative experiences like trauma and seeks to help children build resilience in the aftermath of trauma. With this executive order, there is a possibility that our work could not be supported by federal organizations like the National Science Foundation. This could also impact work being done by the Veterans Administration, or VA, to help individuals who have served our country in the aftermath of their service, who might struggle with things like post-traumatic stress disorder, anxiety disorders, substance use, suicidal ideation, and depression. This banned words list could also affect the basic biomedical research being conducted on women's health. In 2016, the National Institutes of Health issued a notice to consider sex as a biological variable in all of its funded scientific studies. This acknowledges that there might be differences in biological processes based on XX versus XY chromosomes, levels of circulating hormones like testosterone or estrogen that might map on to biological sexes. Without research that is inclusive of all individuals, including women and including persons who have been minoritized, we might have treatments that don't work for everyone and that aren't optimized to ensure everyone receives their full benefits. That is the type of work that is being attacked right now. But there's more. Words like systemic bias appear in all sorts of studies, not just those that are focused on the harms of racism and historical exclusion. For example, somebody who works on earthquakes and natural disasters might talk about systemic bias or error in a model that they're using to mathematically predict the likelihood or scale of a disaster. Scientists who study anxiety or anxiety disorders might study attention bias or threat bias. Again, that word bias on the banned list could mean that basic research to help us understand fundamental cognitive processes that might inform our understanding of things like anxiety disorders could not be supported by one of our largest funders of scientific research in the country. We've discussed how our federal organizations centered around health, like the National Science Foundation, the Centers for Disease Control, and the National Institutes of Health, could be detrimentally affected by recent executive orders. This doesn't just have a consequence for our health, it also has dire economic consequences. For example, in the state of Michigan alone, $900 million of taxpayer funding to the NIH has resulted in $2.6 billion of economic gain for our state alone. And that is just from the investment through the National Institutes of Health, let alone investments through the CDC, the National Science Foundation, and other departments that serve our health and wellness. And that's just our state of Michigan alone, not including the entire country. Every state has economic benefits like this when we invest in our health and in scientific research. So what can you do? We'll be sharing resources in the description to help you get in touch with your senators and your representatives so that you can tell them that you do not support efforts to block, to halt, to stall progress in scientific research that saves lives. You can let your representatives know that you do not support the removal of public health data from the CDC website and several other assaults on the health and the rights of the American people. It's easy to send an email to your legislators, and calling can make even more of an impact. We hope that you'll join us in taking action. Together, we can stay resilient through this crisis and be the superheroes for science in our communities. Thank you so much for listening and for your efforts in advocacy and action.